it's better to see smiling faces than it is to see names on black screens. But it's 10 after. I appreciate the opportunity to be here. I'm grateful for this opportunity to share with you this morning. And I'm going to just get right into it, if that's okay. I'm going to share my screen because I have a whole little PowerPoint here, and I'm going to do my best to get through it in 50 minutes. Okay, let me see if I can do my screen share. Okay, here we go. All right, can you all see my screen?
Yes, ma'am.
Yes.
Let's see if I can get rid of this. And hope my battery lasts for an hour because I forgot my cord. And like she said, I'm actually at a conference for the American Community Gardeners Association, and it's a 2-day event. So I'm here, and I said, well, I'm just gonna do double duty. So we're talking about, oh, come back here, you. We're talking about the brain and healthy aging, and there are things. Now, let me say this. This subject is near and dear to my heart because in 2017, I suffered 2 different brain injuries from car accidents. And I basically had to build back my brain because the injuries that I suffered, one was like a concussion, but the other one was a vestibular brain injury. And I literally had to build back my brain because my short-term memory was gone. My balance was gone. A lot of things about my brain was different, and they have actually remained different, but I am now able to function again from, and it took a while because the brain takes a while to heal once it suffered injury. So this particular subject is kind of important to me. The aging brain and keeping it healthy, maintaining mental and emotional wellness naturally. And then I also had another brain event in 2020. I was hit by a car walking across the street. And then my brain suffered some major trauma behind that. And once again, I had to heal my brain. So brain health, what happens to our brain as we age? And this may get a little bit technical. I have a few little videos. I have this video in here because it's really important. This information is important in terms of cognitive assessments, because these are things that are online. And if you have a loved one or even testing yourself for where you are in terms of your cognition, this is like an easy, simple way to do it. So let's take a look at this. Well, let me see if I can share my sound. First, I want to share my sound. Come back here. Okay, so now let's see if we can do this real quick.
I want to walk you now through a quick test for cognitive disorders. So cognitive disorders result primarily from primary or secondary abnormalities of the central nervous system. They can affect memory and orientation, attention, and judgment. The mini mental status exam is used to test cognitive function.
The mini mental status exam, you want to take a note of that because it is online and you can actually use it yourself.
Now, this is a great screening tool, and it's one that should actually be included in any mental status exam that you do for the patient. It's quick, it's short, it's easy, and again, it's a screening tool, and it'll tell you whether or not you need to dig a little bit deeper into determining if there is, in fact, a cognitive problem. But because errors in cognition can come with all kinds of psychiatric disorders, even general medical conditions. Consider things like depression and psychosis. Sometimes poor memory and concentration can be features of these illnesses. That's why it's really important to get some baseline MMSE on every patient who you encounter. Now, the mini mental status exam, it's also called a Folstein. It's scored out of 30 points, and really anyone falling below a 26 probably has some problems that need a little digger deeping into figuring out what's going on there with their cognition. So there are a lot of things that you can test for. And again, this is scored out of 30 points. Here's a chart that helps to summarize a little bit about what you're looking for. Things like orientation for the patient. Do they know what the month and year is? Do they know where they are, that it's a hospital, what floor they're on, or whether it's an outpatient clinic, what city they're in, etc. So you're really going to score them there based on their orientation. And you're going to want them to name 3 objects and register them, meaning repeat them right back to you. too. You want to be able to test for their attention by giving them some calculations or spelling quiz. Now, before you do this step, it's really important that you know the educational level of your patient so that you can tailor the exam to meet them where they're at. You want to know about their recall, so you ask them to repeat the 3 words they had registered 5 minutes previously. And then you're going to score patients by asking them to name simple objects like a pen and a clock, ask them to repeat a sentence after you, and give them a 3-step command to follow. So other things that you're going to do is see how well they can complete tasks. Tell them to close their eyes, have them write a sentence, and have them copy a design, which should be 3-dimensional and something that they're able to construct without problem. So you'll score all of this. And in summary, the mini mental status exam is testing all kinds of things: orientation, alertness, patient's language skills. You're testing their executive functioning, their recall, their memory. You may also, as part of this exam, throw in some abstractions to see how well they can join objects together. Do they know that an apple and an orange are similar because they're fruits? That's a good example of an abstract thinker. Whereas somebody who's more concrete is going to say, well, they're both round, which is not so good of an answer. So I want to tell you about 2 other quick tests that you can do in terms of checking cognition. So sometimes these come up on exams and on the wards, so they're worth noting. Now, when you're suspecting a cognitive disorder in a patient, let's say you've screened them with the mini mental status exam, they didn't do so well, so you want to take it 1 step further and maybe give them a MOCA, the Montreal Cognitive Assessment. This is, again, a brief screening tool. It only takes about 10 minutes to deliver, and it really tests a variety of things. It can test, compared with the MMSE, it tests things that are a little more sensitive to the detection of a mild cognitive impairment. Okay, so there's a wider range of domains here that you're looking at, including memory and language, attention, also visual spatial things, and executive function. For example, the MOCA includes little quizzes like drawing a clock, telling it to say a certain time. It includes a trail making sequence. They test how quickly a person can name words starting with a certain letter within a minute. So it's just a little bit more challenging than the MMSE and a little bit more nuanced. There's also a test called the mini cog, and this is a clock drawing test and also a test of recall. And this can be really important and a really quick way to assess whether or not somebody's having some cognitive trouble. The clock drawing test is a great way to really see if people are able to connect a sequence of ideas and strategize and do something in a goal-oriented, task-driven way. And then with recall of 3 words, you can really quickly just see how somebody's memory is based off of whether they can recall all 3 words easily or if it's a struggle to even come up with one. So the advantages of the mini cog, again, are the high sensitivity for predicting dementia, the short testing time, because it really takes only a couple of minutes compared to the mini mental status exam or MOCA, which may take about 7 to 10 minutes each. And there is a little bit of diagnostic value that's limited in the mini cog because it's so short, but it's a good way to just clue you in as to whether or not there might be a serious cognition problem that you need to dig deeper for. So you're familiar now with a few quick screening tools. I'd say for your exam, the one to remember is the mini mental status exam. And note that this is important to do not only in patients who may have cognitive trouble, but really you should include it as part of your mental status exam for all patients.
Okay, so now I wanted to share that. I'm going to stop share for a minute. I wanted to share that because those are things that are online that you can actually do at home if you have or with a family member. And you can do those tests before you take them to the doctor. And then you can say, well, we tried this test and we tried this test and we tried this test and this was the results. And that gives your healthcare provider some really good information to go on, and they may repeat those tests and then suggest other diagnostic testing. And you can actually do them for yourself. And I can tell you, when I first went to a neurologist after the last injury that I had, the traumatic injury that I had, I could not pass those tests. So I had work to do. So, but let's move on. Let's move on. Let me see if I can. Here we go. So most physical changes that happen in the body after 50 also have corresponding changes that happen in the brain that affect us mentally and emotionally. Aging is a major risk factor for most neurodegenerative diseases, including mild cognitive impairment and the dementias, of which there are several that include Alzheimer's, cerebral degeneration, Parkinson's, and ALS or Lou Gehrig's disease, which is a muscle wasting disease that actually has a neurological component. While much research is focused on diseases of aging, there's not a lot of information on the biology of the aging brain and how it changes us. But there are things that actually speed up the aging of our brains, which include stress and ROS and our diets and our lack of physical activity, our lack of physical exercise. They actually cause your brain to degenerate and age faster. So let me see, I don't even see my notes on here, but the brain is extremely complex. I'll say that. And it's only been really since the 20th century that people have begun to have any understanding of how the brain functions at all. So even now, there isn't a lot of information and research on neurological function and how our brain works and how our brains age. There are some parts of our brains that do not age, but there's other parts that do. And it doesn't mean that we can't do what we did when we were younger. It just means we have to understand that our brains function and process differently. And so the different functions of different tissues of the brain may or less be susceptible to age-induced changing. Research suggests that aging process is associated with structural differences, chemical differences, your brain chemistry, which is your L-DOPA, your dopamine, and all those things, serotonin levels and all that. The functional changes in the brain, as well as neurocognitive changes, neurocognition. The study of neurological function is fairly new, and its relationship to our mental and emotional health as a field of study is very new. So, and I mean, when I say very new, I mean literally the last 20 years. So the human brain's frontal lobe is the most recently evolved component in our physiology. And it develops last. And it really doesn't fully develop until around between the ages of 27 and 30. And my dad used to say that a man isn't a man until he reaches the age of 30. And I've heard this saying to be true by men who are older, and that's because of how their brains are developing. Even though he didn't have a scientific explanation for it, it's the development and the maturing of the frontal lobe and the prefrontal cortex that really allows us to be able to think and function. And this is known as the executive brain. So that's the frontal lobe, the prefrontal cortex of the brain. It governs judgment, ethical behavior, enabling individuals to set short-term goals, long-term goals, plan their lives, monitor and assess their outcomes. And for decades, this part of the brain was not recognized as important. It was called the silent lobe because people had no idea what the prefrontal lobe did, what the prefrontal cortex did. Now they know that the executive function of the brain is literally what makes us us. It's what is responsible for our imagination and our emotions and our ability to be empathetic and our judgment, as well as our reasoning and functional capacity. So that part of our brain and its development, it develops last, but its development is most important to us. The prefrontal cortex is responsible for empathy, insight, responsible flexibility, emotional regulation, body regulation, our morality, our intuition. And this is the part of the brain that brain diseases like dementia, Alzheimer's, cerebral degeneration, and ALS, this is the part of the brain that is mostly affected by that, because this is our thinking, our reasoning, and also where our limbic brain is, our fight, flight, or freeze stress responses. And our stressors in the body and inflammation in the body and in the brain is going to most affect our prefrontal cortex, and most affect our lives from that point. So the executive function of the brain, mental activities, are what we use to relate to our environment. And it's even what we use to motivate ourselves, is what we use to relate to each other. And these are automatic processes. These are not things that we think about. They just happen automatically. Your brain is firing constantly. It's firing nonstop. And it fires in such a way to its systems function without your conscious realization of it. It performs countless of processes in seconds. This part of our brain, the executive function of the brain, allows us to plan a sequence of ideas, allows us to reason and compare or discard or analyze and choose information, allows us to manage our time, to monitor our time, and give time that are necessary for each task. Okay, we know it's going to take 30 minutes to cook this meal. So our brain function, our executive function of our brain, tells us the sequence in order of things that we have to do in order to make something happen. It organizes and structures information so that information actually has meaning and purpose in our lives. It also governs our inhibitions. And this is our ability to repress instincts and impulses so that we are able to control our behavior. And we see some people who may have mental illnesses and they don't have the ability to control their behavior. That's all governed by the executive function of the brain, which is located in the frontal lobe or the prefrontal cortex of the brain. So being able to focus on, hold information, work with information, filter distractions, switch gears like an air traffic controller system, all of these is what the brain is doing all the time, like nonstop, 24 hours a day, 7 days a week. That's what's governing all of your behavior. So God forbid anything happens to it, right? So remember that the brain is a physical structure like the rest of our body. So like our body, we all know, we can look back over the decades of our life and know that our bodies have changed. Our brain has changed. So what happens to the executive function of the brain as we get older? Well, it generally declines with age, especially after the age of 70. However, because our food system has changed so dramatically, our brains are actually aging faster. So you may find now people who are 45 to 50 having the same cognitive decline as people who are 70 and older simply because of a bad diet. Healthy older adults can generally perform with the executive functioning tasks, but they will not do them at the same way that they would have done them as a younger person because their brain is simply functioning differently. And that's the important thing to know. It's not that we don't have the capability of learning, focus, concentration. We don't get technology. It's just that we have to acknowledge the fact that as we age, our brain is aging and we can't do things the same way that we did them before, but we can do them. So studies have shown that the loss of executive function can be one of the signs of cognitive decline, like she talked about in the video. That makes watching for signs of executive function loss important, as well as finding ways to keep our executive function strong and defend against cognitive problems that are associated with an aging brain. And that includes learning and memory, working memory, attention and concentration, and processing speed. We've all had those moments where we walked into a room and go, now, what did I come in here for? Or like yesterday, I went to Kroger to pick up a prescription and picked up several things, but not the prescription. So, so the normal aging brain, executive function effectively allows us to plan and organize our way through our day, each and every day. That's why, you know, it's good to have, I carry my little notebook. I keep my notebook, my pen in my purse so I can take notes and write down, or I will forget. I'll just like, okay, now what was I supposed to be doing today? If you ask me something, Arlene will tell you, like she called me last night and said, you know, you remember you're doing this? I'm like, oh yeah, is that okay? So requires intact attention, mental manipulation of learned material, abstraction, and adaptation. As we age, there's a relative decline. There's a relative decline in mental flexibility and tendency toward preservation. This is why as people get older, you will see people, once they get to a certain age, they don't want to change. They're trying to preserve and hold on to everything that they did and everything that they know, and they start to decline in the flexibility and learning new information. It doesn't happen to everybody, but it does tend to happen as people get older. I need somebody to put themselves on mute because that's a little bit of a distraction. Thank you. So we develop an increasingly rigid or concrete approach to reasoning as we get older. And like I said, you see people, once they get to a certain age, they become inflexible, but not all people. That really depends on how they're managing their brain health. Now, in the United States, African-American demographics suffer disproportionately, as we know, from a wide range of metabolic dysfunctions as they grow older. And now, actually, these metabolic dysfunctions are happening in far younger populations. I had one friend to tell me she took her daughter to the pediatrician, and the pediatrician told her that during the pandemic, he had just a plethora of young children coming into his office who had hypertension, children who seeing a pediatrician who had hypertension, high cholesterol, and type 2 diabetes and metabolic syndrome. So this has many downstream effects, but the most prominent of these is the toll on cardiovascular system, cardio, heart, vascular, brain. The metabolite profile is a score that assesses neuro brain cognitive function in relationship to other lifestyle diseases. Now, this is talking about African Americans. Healthy cardiovascular function is critical for maintaining neurocognitive efficiency into old age, meaning the health of your heart and the health of your vascular system is important to how your brain functions as you get older. And these things are directly related to your diet. Okay, so attention, verbal learning, cognitive ability are related to blood pressure, cholesterol levels, respectively. Basically, hypertension, diabetes, and high cholesterol ages the brain faster and increases opportunity for brain diseases like Alzheimer's, dementia, and cerebral degeneration, and other brain diseases. It slows down your neurological function. It slows down all of your responses. And all of these things, because of the inflammation markers in your brain is working overtime to try to restore balance to your brain and to your body. And it's working so hard to do those things, it actually takes a toll on your mental health. So defining seniors' mental health include mood disorders. That's things like depression, anxiety disorders. We know what that is. Dementia and Alzheimer's, personality disorders. One of the things that can create a personality disorder in an older population is dehydration. So staying hydrated and maintaining a well-balanced diet is extremely important just for to your behavior. Also, concurrent disorders, and the more serious ones like schizophrenia, autism, and suicidal behavior, which may seem rare in older people, but it really isn't. Suicidal ideations. Now that we know that the brain, particularly the executive function of the prefrontal cortex, plays a fundamental role in our mental and emotional well-being, it is equally as important to understand that our general physical health impacts the health of our brain and thus our mental and emotional state as well. So how we take care of ourselves physically, how we take care of ourselves physically does impact our physical brain. Our brain is a physical structure. It's impacted by what we put into our bodies, which impacts our mental and emotional state. For example, older adults with chronic conditions like as heart disease or hypertension or something like that have predictably higher rates of depression. Disease and depression go together. It's another one of those areas in which the medical community has just started to figure out that if a person has a long-term chronic disease, or if a person has a heart attack, or if a person has a stroke, or if a person has a diagnosis like of kidney failure or something like that, that person their brain is automatically going to send that person into a state of depression. And if they don't treat the depression, that it's harder for the person's body to actually heal. And that's really just a new form of study that's really only been out for about 25 years in the medical community. And in many cases, a person who was observational of the behavior and character of a loved one, they may have to be the one to say their behavior has changed. They might be suffering from depression, because if your provider doesn't know the person, doesn't know what their normal state is, then they wouldn't be able to determine if the person is suffering from depression. I mean, for example, depression looks very different in Black men than it looks in any other population of people. And it also looks differently in Black women. It looks different in older people than it does in younger people. So that's why having an advocate in systems and in care systems is important to help communicate what is that person's norm, because doctors and other providers, they don't know. Now, as I was saying, older adults with chronic conditions have predictably higher rates of depression than people who are healthy. Additionally, untreated depression in an older person with a chronic health condition can cause their condition to become worse. It can negatively impact their overall health. So depression, which is fairly common in older people, and other mood disorders, they manifest differently. One of the more disturbing ways that depression can manifest is in cognitive decline. For example, a person who's depressed may manifest with confusion. They may manifest with agitation. They may manifest with physical pain. And it's not that they're really experiencing those things, but they're experiencing depression that is being manifest differently. And it may look like they have one of these degenerative brain diseases. So the there is a geriatric depression scale. It's a brief 30-item questionnaire. Again, it's online, which participants respond by answering yes or no in reference to how they felt over the past week or 2 weeks or month. The GDS may be used with those who are healthy. It may be used with those with chronic illnesses. It may be used with those who have mild to moderate cognitive impairment. Any positive score above 5 on the GDS, short form, should prompt an in-depth psychological assessment and evaluation for suicide ideation. Now, suicide ideation does not mean, oh, I'm planning to do something to myself. It may look like, well, I really don't have any purpose. Life doesn't have any meaning for me. I'm okay with not being here. It may look differently in an older adult. So depression in older adults tend to present, like I said, lack of energy, lack of interest in activities, lack of pleasure in activities, poor concentration, psychomotor disturbances. It just may look like a person has checked out and you can't get them to engage. And that's what the depression may look like in a geriatric population. So, this is going way faster than I thought. Okay, so we have time to talk. Good. So I like this quote by Stephen Hawking, even though I think coming from Stephen Hawking, it's like really profound if you know who he is. While there's life, there's hope. Stephen Hawking spent most of his life in a wheelchair, completely paralyzed, and he spoke through a computer. So he was actually one of the most brilliant, I think he was a physicist, one of the most brilliant minds who had a body that didn't work. So 5 wise lifestyle choices to help protect your brain. What can we do to protect our brain function? Because there's actually quite a few things that we can do to actually help ourselves. And one is what we eat. So let's take a look at this.
If you sucked all of the moisture out of your brain and broke it down to its constituent nutritional content, what would it look like? Most of the weight of your dehydrated brain would come from fats, also known as lipids. In the remaining brain matter, you would find proteins and amino acids, traces of micronutrients, and glucose. The brain is, of course, more than just the sum of its nutritional parts, but each component does have a distinct impact on functioning, development, mood, and energy. So that post-lunch apathy or late-night alertness you might be feeling, well, that could simply be the effects of food on your brain. Of the fats in your brain, the superstars are omegas 3 and 6. These essential fatty acids, which have been linked to preventing degenerative brain conditions, must come from our diets. So eating omega-rich foods like nuts, seeds, and fatty fish is crucial to the creation and maintenance of cell membranes. And while omegas are good fats for your brain, long-term consumption of other fats, like trans and saturated fats, may compromise brain health. Meanwhile, proteins and amino acids, the building block nutrients of growth and development, manipulate how we feel and behave. Amino acids contain the precursors to neurotransmitters, the chemical messengers that carry signals between neurons, affecting things like mood, sleep, attentiveness, and weight. They're one of the reasons we might feel calm after eating a large plate of pasta, or more alert after a protein-rich meal. The complex combinations of compounds in food can stimulate brain cells to release mood-altering norepinephrine, dopamine, and serotonin. But getting to your brain cells is tricky, and amino acids have to compete for limited access. A diet with a range of foods helps maintain a balanced combination of brain messengers and keeps your mood from getting skewed in one direction or the other. Like the other organs in our bodies, our brains also benefit from a steady supply of micronutrients. Antioxidants in fruits and vegetables strengthen the brain to fight off free radicals that destroy brain cells, enabling your brain to work well for a longer period of time. And without powerful micronutrients like the vitamins B6, B12, and folic acid, our brains would be susceptible to brain disease and mental decline. Trace amounts of the minerals iron, copper, zinc, and sodium are also fundamental to brain health and early cognitive development. In order for the brain to efficiently transform and synthesize these valuable nutrients, it needs fuel, and lots of it. While the human brain only makes up about 2% of our body weight, it uses up to 20% of our energy resources. Most of this energy comes from carbohydrates that our body digests into glucose or blood sugar. The frontal lobes are so sensitive to drops in glucose, in fact, that a change in mental function is one of the primary signals of nutrient deficiency. Assuming that we are getting glucose regularly, how does the specific type of carbohydrates we eat affect our brains? Carbs come in 3 forms: starch, sugar, and fiber. While on most nutrition labels, they are all lumped into one total carb count, the ratio of the sugar and fiber subgroups to the whole amount affect how the body and brain respond. A high glycemic food, like white bread, causes a rapid release of glucose into the blood, and then comes the dip. Blood sugar shoots down, and with it, our attention span and mood. On the other hand, oats, grains, and legumes have slower glucose release, enabling a steadier level of attentiveness. For sustained brain power, opting for a varied diet of nutrient-rich foods is critical. When it comes to what you bite, chew, and swallow, your choices have a direct and long-lasting effect on the most powerful organ in your body.
Okay, I had a few more slides, but I'm going to stop share and see if you all have any questions. Questions, comments, concerns, anything?
This is Sister Marshall. Just a quick, I'm sorry, interruption. You have about 10 more minutes.
Okay, and I probably have less than that left on my battery. So I'm just gonna finish this up just so I can say, okay, now.
And I believe there was a question before I interrupted.
Okay.
Yes, I have a quick question. If a person has already started cognitive decline, can diet help to keep
Yes.
them from declining more rapidly?
Absolutely, yes. And one of the major components of cognitive decline that affects one's diet is their inflammation markers. And having a diet that kills inflammation as opposed to promotes inflammation in the body is going to be critical to reversing the effects of dietary stressors on the brain as well as on the body. So there are a lot of supplements that one could take that are very helpful, natural supplements that help the brain, help repair the brain, help reduce inflammation markers. And those would include ginkgo biloba, DHA, EPA, which is like a component of omega-3s, omega-3s themselves, ginseng, an Indian herb called bacopa, as well as fatty vitamins, or like sort of oil-based vitamins like vitamin A and vitamin C. There are newer supplements on the market that, because brain health and what is happening to our brains in this society has become such a major issue in the last decade. There are newer supplements like Focus Factor, Prevagen, Piperzen that do show promising results in helping people's cognition and memory. So a large population-based observational study found that healthy older adults who used antioxidants, including vitamin E and vitamin C and multivitamins, were 50% less likely to experience cognitive decline at 5-year follow-ups compared with people who didn't take any supplements at all. So natural supplements that sort of help the brain, like I said, include ginkgo, omega-3, ginseng, vitamin B12, vitamin B3 and B9, huperzine, vitamin D, caprylic acid, which comes from coconut oil, resveratrol, and curcumin, which is turmeric, which is an anti-inflammatory. So ways to improve the executive function of your brain include staying active, exercise, taking a daily walk, working out at the gym. Exercise your brain, like exercise helps your body, exercise helps your brain. Studies have shown aerobic exercise helps older adults, one, maintain their physical balance, which is essential, but it also helps you to maintain cognitive function as well in areas such as focusing attention, the ability to switch between tasks, and the ability to hold multiple items in your working memory. So that's what exercise does for you. It's important to stay physically active. Supplements, again, we talked about, they help the memory, they help moods. You're like SAMe helps your mood as well as your memory. It helps alleviate depression. It helps your mental function. Omega-3 is an anti-inflammatory as well as turmeric, anti-inflammatories in the body and the brain. DHA and FDA is a supplement that elevates your mood. DHEA elevates your mood and helps your brain and your neuroplasticity. And another way, of course, you got to get your brain to do something. It's got to work. It's got to do something. Put it to work. Figure out new things. Play games. Arlene is real good at all these little games that she comes up with. It's like, oh my God, okay. So bolster your executive function of your brain is to learn new things, to stimulate your brain, to slow down the cognitive decline of the executive function. Work on mental flexibility, work on crossword puzzles or card games or word games, or there's a website called Brain Fit. It has a lot of suggestions for exercises for the brain. And that's it, I'm done. Let me see if I can stop share now.
Dr. Quanda, just wanted to let you know we appreciate you sharing with us, and thank you for your wealth of information and your knowledge that you have brought to the table today. So thank you.
Thank you.